Here we have to mainly study about hemophilia. We have studied about hemophilia, I think, in 10th standard and also in 12th standard. So you know what is hemophilia. It is a genetic disorder. Now what is mainly happening in hemophilia is that the clotting will not be in a proper way. What usually happens in 10 minutes sometimes takes 10 hours or more than that. Sometimes 2-3 days the clotting will be continuing. So this is what is happening in the case of hemophilia. Now it's actually defined as a hereditary genetic disorder that impair means damage the body's ability to control blood clotting. So clotting is a actually safety mechanism of our body to prevent the loss of blood. So that mechanism will not be working. So hemophilia A, there are two categories of hemophilia. The most common is the hemophilia A, and that is affecting uh, nearly 1 in 5,000 to 10,000 male birth. Is out of 5,000 or 10,000 male men born, one may be having this hemophilia. Then, so here it can be in there is a clotting factor. Last class we have studied about different type of proteins involved in that, which we call clotting factor, especially clotting factor 8. The deficiency of that 8 is responsible for this kind of disorder, hemophilia A. Now, in case of hemophilia B, it is the clotting factor 9. Deficiency of 9 is leading to this kind of, that is far more rare. Here it is 1 in 10,000, here it is 1 in 34,000. That is the probability of hemophilia B. So these are the two categories of hemophilia. Now, like other recessive sex-linked X chromosome disorder, you might have studied in genetics that we have X chromosome, Y chromosome, and male have one X chromosome and Y chromosome, and women have two X chromosome. So for a character to be observed in a woman, two copies of the same defective gene should be there. But in the case of male, there is one X chromosome and one Y chromosome. So even if there is only one copy of the defective gene in X chromosome, that character will be fully expressed or fully observed. So that is why men have a higher probability of this kind of genetic linked or X-linked chromosomal disorder. So like other recessive, recessive means you have studied about Mendel's genetics. Now in Mendel, there are for example, you might have studied about pea plant, round pea plant, and other type of pea plant. So one gene will be always dominant, other will be recessive. That is, if there is a X and a small x, capital X will be always expressed. So that is why. So this kind of genetic deficiency are usually present in the X chromosome. So they are a recessive gene also. So in presence of a dominant, for example, women, they have this small x and a capital X. That means the capital X has no hemophilia gene, small x has a hemophilia gene. That means in women that character will not be observed. So that women may not be having any hemophilia. And we call that kind of women as a carrier in hemophilia. They will not have any symptom, but if they pass it the same defective gene to male member, a male son, that son will be having hemophilia. So this is how it is actually going on. Because female have two X chromosome, hemophilia is rare because it is a recessive gene. The change of the female, the chance of female having two defective copies of the gene is very rare. So that is why it is mostly a male disorder. So females are almost exclusively asymptomatic. Asymptomatic means they have the gene but they will not be showing any symptom. That is why asymptomatic carrier of the disorder. Now the non-linked, non-sex-linked hemophilia C, that is the category, third type of hemophilia, due to coagulant factor 9 deficiency. coagulant factor 11 deficiency, which can affect either sex, is more common. Use of Ashkenazi, Eastern European descent, but are very rare in other population groups. So here we are finding three categories of hemophilia: A due to deficiency of factor A, B due to deficiency of factor 9, and C due to deficiency of factor 11. But that is one of the most rarest form of hemophilia. Here you can see that what happens in the case of a hemophilia. So normally, if there is a damage to a blood vessel, at that point there will be fibrin threads. Fibrinogen will be converted into fibrin. Here also this process is taking place, but in a very little way. So that is why this hemophilia is causing loss of lot of blood, so that the person has to apply some bandage for a long time. Sometimes doctors will be prescribing clotting drugs also, so that it helps to prevent. People with hemophilia have a lower clotting factor level of blood plasma or impaired activity of the coagulation factors needed for the clotting factor. But here, so when a blood vessel is injured, a temporary scab, even though scab means Malayalam we call kotta. So that will be forming, but it may not be very effective in preventing the loss of blood, and which is necessary to maintain the blood flow. A hemophilia does not bleed more intensively than a person without it, but can bleed for much longer time. There is no heavy bleeding; it is only longer bleeding. The bleeding level is same, but it will be continuing for several hours, sometimes more than 1 or 2 days. In a severe hemophilia, even minor injury can result in blood loss lasting days or weeks, or even never healing completely. That is also a problem. So this kind of people has to be very careful. There is nothing we can do. Only thing is protection. They have to be very careful while handling different type of like a knife, scissor, blade, etc. And that will be causing a lot of problem. In areas such as brain or inside joints, this can be fatal or permanently debilitating. Debilitating means damage. That is the meaning of causing extreme damage. That is the meaning of the debilitating. And fatal means causing death. So in areas such as brain or inside joints, for example, if there is a clot, there is a bleeding in brain, and that blood is actually losing into other areas of the brain. So lot of brain cells will be actually immersed or sinking in this blood, and they will die. So that will be lot causing stroke or other kind of problems. So that is the problem with the hemophilia. So this is an idea how hemophilia is affected. Now the second disease is the arteriosclerosis. Here, this is also something you might have studied. Occurs when blood vessel from your heart to the rest of your body become thick and stiff. Here, this is idea is very clear. So here, this is a normal blood vessel, and sometimes what happens is that our cholesterol, they get deposited on the inner wall of the blood vessel, and over a period of several months, sometimes several years, the deposition increase in size, and that will be almost blocking the lumen. Lumen means the cavity of the blood vessel, so that little blood will be coming or flowing through that. And that situation is what we call by the name block. Sometimes the entire blood flow is actually prevented. That is why sometimes old people say they have a block in the heart or they have a block in the brain. So this is what is happening because of the cholesterol deposition. This blood vessel will be blocked, so blood may not be able to flow. So that is the main problem with the cholesterol. Cholesterol, because even though the fat is when we are eating fat, we do not think it is a harmful thing. But after a certain age, taking too much of fat means some of the fat will be deposited in this pulse, in the inside the blood vessel, which can block and blocking of the blood vessel. For example, if there is a block to the blood vessel going to the brain, what happens? that part of the brain may not be getting enough blood and brain cells there will die. That is situation is what we call by the stroke. So stroke is actually lack of blood supply to the brain. Now another situation of block is that a blood vessel giving your heart blood. For example, there are a number of blood vessels which supply your heart muscle with the blood. If any kind of block like this is occurring in such a blood vessel going to the heart muscle will not get the oxygen, so they will die. So that is resulting in heart attack. So these are the two common problems of mostly this what is called blood vessel blocking. Now there is another kind. Sometimes some blood vessel going to your legs. A blood clot will be happening there. So what happens? The lower part of your body, they will not get enough blood. So that also is another kind of problem. So arteriosclerosis occurs when blood vessels from your heart to the rest of the body become thick and stiff, sometimes restricting blood flow to your organs and tissue. Healthy arteries are flexible and elastic. That's another important thing. Normally, you take any rubber tube. It has a certain elasticity. You take a cycle tube. It has an elasticity. But in case of this, when it is deposited with this kind of fatty tissue, this flexibility of the blood vessel or elastic nature of the blood vessel become lost, and it becomes a rigid tube. It will not expand, and that situation will also lead to rise in blood pressure also. Now, the wall of your arteries can harden, a condition commonly known by the name hardening of artery. That is the meaning of arterio means artery, sclerosis means hardening. So, arteriosclerosis technically means hardening of arteries. So, arteriosclerosis is specific type of atherosclerosis is a specific type of arteriosclerosis, but terms are sometimes used interchangeably. Atherosclerosis refers to buildup of fat, cholesterol, and other substance which can restrict the blood. There are two terms. One is arteriosclerosis, one is atherosclerosis. Some people use atherosclerosis, but there is not much difference between them. These plaques can burst and triggering a blood clot. So what happens sometimes is that, for example, here there is a blood clot. In some rare condition, what happens is a certain portion of this clot will detach from the, and it will be floating in the blood vessel. And when that clot is reaching a smaller blood vessel, it will be completely blocking that smaller blood vessel. So that kind of floating clot can also happen in sometimes in your body. Although this is often considered a heart problem, it can affect arteries anywhere in your body. And atherosclerosis is usually preventable and treatable. Sometimes you might have seen how these doctors are doing in this. I will show you one. See here you can see that when this kind of situation is happening, what doctors are doing is that. So this is here a block is there. See, this is a block, and what doctors will be doing is that here this is a block, artery filled with some this yellow color is cholesterol. Now what they do is that they will pass a tube into this, and at the end of the tube there is a balloon. When the tube reaches this size, this balloon will be inflated. So what happens is that this the lumen or this cavity will be dilated. So in order to keep that dilation, what they do is that they will keep a steel ring. That steel ring is called stent. Here you can see this is a steel ring. So even if the doctor is removing the balloon, the steel ring will be there. So that size of the artery or the diameter of the artery will be kept there. So that is why sometimes your grandparents maybe say put one stent, two stent, three stent. So stent is a word sometimes you might have heard. So for each stent the doctor hospital will charge you a good amount. Sometimes if there are four stents they will charge you 2 lakhs or something. So it's a money making business. So sometimes they will ask you, one stent may be enough. They will say, put three stents. That means they will get a lot of money. So this is all a helpless situation for most of the people. So this is what is happening in arteriosclerosis treatment. Now, next one is we will take blood pressure. Now, the next one is the blood pressure. It's the pressure exerted by the circulating blood on the wall of the blood vessel. When usually with the further specification, blood pressure usually refers to arterial blood pressure. So that is what is not there is pressure within the artery. There are arteries are the veins are also there. So normally when we say blood pressure, we normally mean pressure within our blood arteries. It is usually measured at persons for upper arm. Here we are usually measuring it. And blood pressure is usually expressed in terms of systolic pressure over diastolic pressure. There are two types of pressure. That is, when heart is pumping blood, more blood will be reaching blood vessels. So the volume of the blood in the artery will be more and pressure will be also more. Whereas heart is relaxing, there will not be any blood coming from heart. So less volume of blood will be present in your artery. So the pressure of the blood or the force produced will be also less and the pressure will be very low. So that pressure is known by the name diastolic pressure. So normally we can see a maximum pressure or higher pressure which we call by the name systolic pressure and a lower pressure or a minimum pressure which we call by the name diastolic pressure. And normally this is systolic pressure will be 120 and diastolic pressure will be 80. So this is the normal blood pressure, and in situations sometimes this pressure of the person may increase, especially with the older age when your body is aging, your blood vessels become less flexible, okay, and that will increase the blood pressure. Problem with the blood pressure is that the body, entire body system is designed to operate at this blood pressure. Okay, but if it is like now our Kerala Water Authority has a small tubes, plastic tubes are there. Normally there is a water pressure, and if the water pressure is increased two times, what will happen to that plastic pipes? They may break or they may burst. The same thing happens here. Now in our kidney we have small blood vessels are there, or nephrons you might have studied. They have very fine small blood vessel. So when there is high blood pressure, these small capillaries will damage, they will break. So the problem with the blood pressure is that each time the blood pressure increases, these small blood vessels in your kidney will be damaging, and that will lead to kidney malfunction, or sometimes kidney will completely get damaged. So this is the problem with the blood pressure, and because of that, blood pressure is always known as a silent killer, because unless you check your body with this pressure apparatus or sphygmomanometer, there is no visible symptom. You will find you will be appear perfectly okay. You don't think you have a problem with the blood pressure, but body is somehow managing. Your body is working in overload, and kidney is getting damaged. Only when severe level of damage comes into picture, you may notice some visible symptom. Before that, there are no symptoms. That is why blood pressure is known as a silent killer. And normally, this 120 is the normal maximum pressure. If it is going to 130, it is you can do some exercises, make some control in food habits, etc. Eat less fat and other things, so that to certain extent you can reduce it. But if it is going above 140, then you may need to go for a multiple blood treatment. We have to take some kind of blood pressure reducing drugs are there, and that has to be taken for a long time, sometimes lifelong. Otherwise what? Because with exercise alone, it is not always possible to control blood pressure. So if it is in a if it is within the level below 140, you can do that. Otherwise, what happen is that if pressure is above 140, the risk factor is increasing. Your kidney may get damaged. If kidney is damaged, the only possibility is to kidney replacement. So that is become more heavy. So that is a problem with the blood pressure. Now just like any drugs, blood pressure drug has also its own problem, but there is no drug in the world, whether any kind of medicine, in the allopathy, Ayurveda, or homeopathy, every drug has is like interfering in your normal body mechanism. So it will have some side effects. So blood pressure drug also have some side effects. So that is one problem in taking any, whether you take cholesterol drug or you take blood pressure. Every drug is having its own problem. So it has to be taken in a moderation. Just because by taking blood pressure, okay, I have blood pressure and I am taking tablets, and the person think that okay, I am fine with now blood, and he is taking too much of fat and he is not doing exercise, blood pressure will again increase. So first it may be 2.5 milligram, then it may increase to 5 milligram, then it may go to 20 milligram, then it may go to 40 milligram. That means the risk factor or side effects of the drugs are actually increasing. So if it is a lower dose, the risk factor side effects may be minimized. So this is the advantage of this is what we can do with the blood pressure, and this is something everybody has to be prepared. At an age after 40 or 50, everybody will get into this kind of situation. Once one problem comes, if there is blood pressure, then cholesterol is in waiting, and other problems, heart problems, that they are in queue. They are just like on the queue. You and this stroke, every problem is there. So these are always very close friends. If blood pressure is there, cholesterol will be there, and sometimes it will also lead to diabetes. So these are actually members of the same family, and they will all come together. So there is a problem, and both have many causes which range from mild to severe. So long-term hypertension is a risk factor, including kidney failure, heart disease, and stroke. These are the three major problems. Already we have told about that. And long-term hypertension is more common than long-term hypotension. Some people may have a lower blood pressure. Instead of 80, they may have only have 65. And if it is a normal situation, that means it is there throughout their life. It is not a big problem. But if the pressure is more, it can create more problem. And long-term hypertension often goes undetected because of infrequent monitoring and absence of symptoms. So these are the things that you have to remember while dealing with the blood pressure. Then remember that blood pressure is a silent killer. So it is very important that you monitor your blood pressure, you monitor your sugar level, and you monitor your cholesterol. These are actually indicators. And if these indicators are within normal level, your body is in normal level. So that is what you can do with your body. So we have one more topic, and I think that takes a little more time. We will take in our next class.